from a while ago.
So we are now live.
Mom.
We are now live.
So, Dr. Thiagarajan, we are ready to start.
Yes, sir, we are ready to start.
Okay. Very good afternoon to all of you. I welcome you all for the third webinar on sports medicine and sports sciences by Indian Association of Sports Medicine. Today we have a talk on sports rehab and injury preventions, and we have a very interesting lectures and very eminent faculties. And at the outset, I'd like to thank our faculties, especially Janine Gray and Andrew Gray, who is joining us from South Africa. And it's my great pleasure to introduce our first speaker, Dr. Janine Gray from South Africa. She is a physiotherapist with an academic interest in injury prevention, shoulder and lower back injury in sportsmen and cricket-related research. She has got a PhD in biomechanical, physiological, and muscle recruitment factors in low back pain in adolescent fast bowlers. She is an honorary faculty at University of Cape Town in the Division of Exercise Science and Sports Medicine, and she is a consultant for Center for Sports Science at Sri Ramsar University. Hi, Janine. Please go on with the lecture.
Hi. Good morning, although I think it's good afternoon for you, everyone. Yeah, I'm going to be giving just a few ideas on how sports rehabilitation has changed for me in the last year. So hopefully some of these will be new to you, but they are just a couple of pools of things that have changed for me over the last year or so. We're going to look at two areas. One, and I'm actually going to start with injury prevention first, and then just a couple of rehab principles and just a couple of ideas, particularly on lower back rehabilitation, as well as some tendon work. So if we look at injury prevention, I mean, we all have seen this model before. It's a very complex model as to what causes injury. There are a number of factors, intrinsic, extrinsic, some are modifiable, some are not modifiable. But really, what I want to concentrate on is two areas, one in particular. One is just obviously ongoing preventative exercises that we put together for different groups of at-risk athletes. I've done quite a bit of research looking at lower back injuries in fast bowlers in cricket, as well as shoulder injuries in cricketers. And based on that research, we've been able to put together these two preventative programs, one for the lower back and one for the shoulder. I think probably the one take-home message with this is that anybody can put together these rehab programs. But what we have found is that you've got to be very careful about borrowing rehab programs from different sports and also different levels of performance. So we have done a lot of research looking at the shoulders of cricketers, and we found that the cricketer's shoulder is not a typical thrower shoulder. So we've got to be very careful about borrowing rehab programs from baseball, for instance, because the shoulder of a cricketer actually looks quite different. Similarly, we've just done some research looking at throwers and what musculoskeletal risk factors contribute to performance. And we found that the musculoskeletal variables contributing to performance are different for elite and amateur athletes. So perhaps the take-home message from that is preventative exercises can work, but you need to be specific to the population you are working with, and nothing beats assessing them first. So to make the program as individualized and tailored as possible. But with regards to prevention, probably one of the areas where I've been contributing most of, or a lot of my time with athletes is the consequences of not getting enough sleep. This really, when you attend any of the conferences on sleep, sleep deprivation has become a pandemic, and it's certainly no different in our adolescent athletes, which is an area I work with a lot. And probably, I mean, there are a number of well-established risk factors that occur because of deficient sleep. But probably the one that we're obviously going to concentrate on today is an increased sports related injuries that happen. The other point I just want to make, and it's certainly one that has helped us sell better sleep to our athletes, is that a number of the factors that make a good performer, elite athlete are things like emotion, attention, executive function, memory, and a number of these are very negatively affected by sleep. So not only if we improve sleep are we going to reduce our risk of injury, but there's a very good chance we can include the performance of our athletes. So really something we'd want to aim for. So just to put it in perspective, chronic lack of sleep in adolescents is associated with a greater risk of injury of 1.58 times. Similar findings have been found in athletes. And just to be a little bit more specific, they found that athletes who sleep an average of less than 8 hours have 1 to 7 times greater risk of being injured. So they're almost doubly at risk than those who sleep more than 8 hours. When you inquire on your adolescent athletes how much sleep they are getting, it is frightening how few of them are actually getting a good 8 hours of sleep a night. So just their sleep puts them at risk of injury before anything else. So we've been spending a lot of time looking at sleep profiles and intervening, whether it is with screen time limitations, or actually there are a couple of them that have actually needed medication to get into good habitual sleeping postures. Obviously that needs to be done with a medical professional guiding you. So please, sleep is really important. Recovery from injury is impacted by sleep as well. So really concentrate on that. Then just to look at some rehabilitation topics, I've been quite concerned at a number of conferences I've been to and the literature, which seems to either promote general graded strengthening programs or just strengthening programs and flexibility, or segmental stabilization, so all our motor control programs. And it really does seem that the pendulum seems to swing between the two. Either the segmental stabilizations are very in fashion and they're what is done, or it'll swing to the other side and people say that we need to do more just strengthening, general strengthening programs. Speaking in this direction is a number of meta-analyses. That this one was conducted in 2014. And really what they found here was that there was strong evidence that stabilization exercises are not more effective than any other form of active exercise. And so when reading different reviews like this, a lot of the websites that speak on rehabilitation and that have seemed to interpret this, that because stabilization exercises are no better than other exercises, that perhaps we don't need to waste our time with transversus abdominis and multifidus. So I just wanted to look at a couple of the literature or the journal articles that were used in the review. There are 1 or 2 different ones here as well. And really, I think the message that I want to get across, if you just quickly look through them, comparing general exercise to motor control, stabilization to exercise routines, general exercise to motor control compared to spinal manipulation, there are a lot of different interactions that they've assessed. And actually the most important finding is that all groups improved. So whether it was segmental stability or general exercise or spinal manipulation, all the groups improved. So that is very positive, and it speaks to both interventions, both stabilization and general strengthening being important. I just need to point out, because I think stabilization is particularly important, the Franco article and the last one that's just been done in 2020, there was some benefit seen in the stabilization exercises versus just general exercises. And I think one of the things that does come up and recur, although not all the time in the reviews, is that there is an improvement, a longer lasting decrease in pain with stabilization. But if we just, the take home from message from this should be that both forms of exercise work. But why, and my argument is that I think both should be included. We shouldn't be doing an either or, we should be doing a combination of exercises. And the reason for this is that I think the different types of strengthening or rehabilitation programs actually target different systems. The stabilization programs, retraining, transverse abdominis, and motor control very much target the brain and the neural system. Whereas the graded strengthening programs are going to target the specific muscles themselves, and they work through neural adaptation in strengthening as well as hypertrophy. So the mechanism for the two types of exercises are quite different. And I think both are absolutely valuable. So it shouldn't be an either or. Stabilization exercises are really important for retraining segmental control. So we don't hinge on a single level. It's also important for increasing intra-abdominal pressure. That helps with dealing with load. It facilitates better respiratory capacity. And I'm going to discuss this in a moment because I think this is essential for our athletes. And global muscles don't, if the stability system is working, now don't need to try and stabilize the spine in this very mechanistic compression type of stabilization. But similarly, global exercises are equally as important. We have to be able to have good strengthening so that we can dissipate forces that are involved with landing. For instance, we know a fast bowler, when he lands, has 4 to 6 times his body weight of force coming through his front leg. So we need a very strong global muscle system to deal with that. In addition, our global muscles actually need to generate the high velocity, the forceful movements particularly needed in sport. So it can't be a case of either or, it has to be a case of both. Just a quick word on respiratory capacity. It's one of the pools that I'd say over the last 3 years I've been using a lot more. With athletes, and they require a greater respiratory capacity. And I have found in a number of my athletes battling with chronic back pain, they really battle to recover their breathing after an intense bout of exercise, which could be a single bowling delivery. And they battle to control their breathing. Following segmental retraining and transverse abdominis recruitment, their breathing and their ability to recover is markedly improved. And there is literature to support the fact that transverse abdominis and internal oblique are really important in good breathing patterns. So really important in our athletes to retrain breathing the capacity of the respiratory system. And we do this through retraining the segmental system as well as various respiratory exercises. So really the take-home message is here is that the pendulum needs to stop swinging, I think, between the different types of exercise programs and actually land in the middle where we combine manual therapy, stabilization exercises, strengthening exercises, stretching and education. Educating your patient as to the reasons for their pain, so that they understand chronic pain mechanisms, and the things that they can do in activities of daily living are also really important. So we need to try and settle the pendulum somewhere in the middle. Just another point that I've been working with a lot with my athletes following injury, particularly significant or catastrophic injury, is the fear of injury. one of the things they found is that obviously the fear of injury changes motor patterns and changes the way athletes function, and can change how, for example, a rugby player would go into a tackle. And the brain actually needs to overcome this fear of re-injury and the initial injury. So this needs to be included in all our rehabilitation programs. We need to be able to include exercises that either mimic the mechanism of injury, so an ACL injury. We need to be able to retrain whether it was a sidestep that they did and work in that type of injury. We need to put them under high pressure situations. Or for example, a player who may have tackled awkwardly with their neck, we have to retrain that impact in order to reduce the fear. Just a quick word on, obviously we all use pain with the visual analog scale 0 to 10. How much pain do you have? I use confidence and fear as other markers for how ready an athlete is for return to play. To get honest answers here, you obviously need to have a really good relationship with your patients, but you can really get a good idea on how ready they are for return to play based on confidence and fear. There have been a number of studies to support what fear does. It increases, there's an increased reduction in the endurance of paraspinal muscles when patients are exposed to fear. So the actual experience of fear of going back to play can affect or impact the ability of the lower back to function. And these changes are actually specific to the patient. So it's not just general stress or general fear. It would be a clinically relevant stress to that patient. I want to spend my last minute just speaking about the impact of a different type of training, which I've started to use, which is a neuroplasticity training. One of the things that they found when they looked at isometric exercises in our tendon patients was simply doing an isometric exercise before testing the strength, improved the strength of the quadriceps by 20%, which indicated that there was previous inhibition. So what we've started to use was presented in a paper, references on the bottom right-hand side of your screen, where you combine heavy strength training, which can be isometric or isotonic, with an external pacing strategy. So this is when you control the concentric and eccentric parts of the movement, the exercise you give them, by some auditory or visual cue. So it might be that you want to concentrate on the eccentric component. So you would say, right, I want you to do a calf raise, lift up, 1, 2, and down, 4, 3, 2, 1. And they do it to an auditory stimulation. They can also use a metronome. And that has been found to really improve that cortical inhibition and to allow better facilitate strengthening in tendon patients. Right, so that's my message, my couple of pulls on rehabilitation and injury prevention. Yeah, I'd just like to use this opportunity to say that, I hope you all stay safe and that together as a world we can beat this coronavirus. So please stay safe, you and your families.
Thank you very much, Janine, for an elegant and a crisp talk as usual. And I'd like to stay with us and we'll go on to the next talk. Then we can take the questions. So it's my pleasure to introduce the next speaker, Mr. Andrew Gray from South Africa. He's a consultant biokineticist. He's a faculty at the Center for Sports Science at Chennai. His expertise in rehab and training of elite athletes from around the world. Worked with the South African national cricket and football teams. Andrew is an elite athlete by himself, and he regularly takes part in endurance events, including Ironman. And Andrew, is all yours now.
Thank you very much for the introduction. I just want to get to share my screen. Is that okay? Can everybody see it? Can somebody just give me an indication if they can see that screen?
Yeah, we all see you, not your slide.
Not my screen. Hold on one second.
Yeah, now we can see your presentation.
All right, so we can see that. Can everybody see me?
Yeah, can you hear
All right,
it
yes.
as well as you can see?
Thank you very much for the introduction, Professor Arumugam. Good morning or afternoon, everybody. So it's a really big topic that I think I would like to talk on, and really what I'd like to do today is just to put some questions out there regarding our principles and concepts behind how we approach strength and conditioning, and to provide some current updates. Again, I have been involved at national level for 2 or 3 sports back home in South Africa. And more recently, I've been doing a lot of work with junior athletes, high school athletes, 13 to 20 or 21 years of age. And I think there's some important pearls that we can take out of just questioning some of the principles that I think we both are teaching and learning in terms of strength and conditioning. Just to start off with, I still think there are 2 precepts that we have to acknowledge when we do any sort of strength or conditioning programs. The one is to improve performance, and the other one is to reduce the risk of injury. And certainly in South Africa, improving performance seems to be the main focus of a lot of our sports, of a lot of our conditioners. But the risk of injury seems to be one of the major scourges, especially in our developing athletes. In our young, immature athletes, we find that the risk of injury seems to be on the increase all the time. I'd also like to suggest that our current methods and the current tools that we use in strength and conditioning don't improve performance as much as it could do, and certainly don't address the risk of injury. And I think there's some quite clear and basic principles that we can look to alter and change in order to improve both factors of that. Just as a way of understanding, what I don't want to do is I don't want to question the factors that sit behind program design or even the training variables. These variables and the principles of training are still, we still acknowledge that they are applicable, but the way in which we interpret the information and the way we put programs together is more the aspect that I want to look into today. So basically, just to start from a conceptual point of view, the majority of us, certainly the way that strength and conditioning is taught, we are taught along a linear periodization type of model where there are specific parameters which athletes, almost like hoops where athletes need to go through. You go through an endurance phase and then you go into a strength phase. And these phases are spread out along the way. But there is realistically only one journey and one pathway to getting towards an improved performance. I've included this because to me, there are a number of things that stand out for me, and I want to highlight the potential concerns and that I have with this type of model that is a linear periodized model. Probably the first one that stands out is the volume. The volume is extremely high for lengthy periods of your preparation period. And that we know in a lot of our younger athletes, and even in what Janine has said, that high volume training has its risks, both for an elite athlete as well as for our developing athletes. So the fact that we spend such a large amount of our time involved in volume training really concerns me. And it certainly does highlight both the risk of injury and infection and of illness. The other aspect that I'd like to highlight here is the opportunity of intensity being very, very low. My understanding, both practically within the field and the profession of strength and conditioning training, as well as speaking to a lot of the world-renowned coaches, is that it's the intensity of exercise or the speed at which we do things that is the absolute golden thread that classifies a really elite performer from somebody that's moderate or average. And what concerns me here, again, is the amount of time in our season that we spend doing work that is not appropriate for the intensity of the sport when we compete. And that is a real concern. So those are my concerns in terms of what we have. The other aspect that I want to highlight here, just by the nature of the graph, just by looking at how wide the various principles are, we do seem to spend a lot of time in the preparatory phase. Also doing skill training, and skill training I'm going to allude to slightly later, but we also deal with skill training, again, at a much lower intensity. Just to quote a very simple example, it's very easy for me to face a spin bowler because I have an opportunity to develop the right technique because the ball's coming to me very slowly. If the ball's coming to me at 150 kilometers an hour, my responses have to be quite different. And we do understand from a medical science point of view, we understand that the body responds to specificity of training very, very particularly. And I think this sort of model indicates that we spend a lot of our time at intensities that are lower than what we do need in the field of play. So the model that I want to go into a little bit more today is more of an undulating or a periodized model. And this to me seems to make a lot more sense because it allows us to train the body in various ways. So just to give you some idea, the undulating model has two variations to it. One is an alternating one, which is high and low, and the other one, which is slightly more advanced, which is a low, medium, and high. And the high and low, you can alternate high and low training days. These can be volume, these can be intensity, these can be upper body, lower body days. And similarly, the advanced ones, you could add things like speed, power, agility, depending on the sporting structure and the sport that you're involved with, will depend on how you then populate these undulated periods. So very simply, if we look at it just from a graphical and a picture perspective, we can see, number one, that there's spaces in our week. There are really spaces in our week that allow us for rest period. And as the previous speaker, Janine, has just identified, that rest and sleep and recovery are vitally important aspects in terms of our preparation and avoiding the risk or reducing the risk of injury. The other aspect that I want to highlight here is that we are actually training energy systems. And this is where it becomes the metabolic aspect of this training, is that you don't train according to strength. What you do is you train according to metabolic systems. So we've got power, endurance, and speed. And these energy systems, or the energy systems that fuel these activities, are the aspects that we want to train. So fatigue in one energy system wouldn't allow us to be fatigued in another energy system. So what it does allow us to do, it allows us to train a system until it's fatigued, then allow it a rest period, and then train an additional system. And that's a very, very sure way of ensuring that we are managing load and we're managing the risk of injury that any athlete may have. The other thing that I want to highlight from this as well is that the sport that we do, or the sport that we are training individuals for, can determine how many of these energy systems we need to train. And you can add technique as an additional aspect of this. So why do I like this undulated model? Number one, it helps us manage fatigue, and it reduces the accumulation effect on fatigue. Historically, in dealing with professional sides, especially back home in South Africa, we seem to work on the volume principle, where the more I train, the better I'm going to become. But when you're dealing with high activity, high intensity sports, we realize that the repetitive nature of training, if it's not planned, has a deleterious and a negative effect on ultimate performance. Right? The other aspect that I really like about this is that it adapts the stimulus recovery adaptation. So in the graph that we've got there, we see that majority of our training actually takes place during the recovery phase. So if we've got Monday, Tuesday, Wednesday, Thursday scenarios where we're training the same energy system in the same way, what we're doing is we have a negative cycle. So the net result is this recovery cycle ends up being in a negative slant as opposed to being in a positive slant. So what we're doing is we're always managing the negative as opposed to allowing for compensation to happen, allowing for recovery to happen, and then training that energy system again once it's into that super compensation model. And then lastly here, it does allow for technical training, which I'll get into shortly. So if we look at this from a week-to-week perspective, it's very simple to put together. And again, I've just chosen an example here, but you can identify this in any way that you want to. But basically, my training weeks start on a Tuesday, and we call this Fundamental Tuesdays. So we have a 90-minute skill building session. So we're building skill into it. No matter what the sport is, no matter what the activities are, as the coach or as the conditioning person, the skill has to be built into it. And it can be built in a physiological component as well. All right? You have an energetic weight room session. And again, that energetic weight room session is based on which energy systems you're wanting to train. If you're a water polo player or a cricketer, it might be an upper body session that's more power-based, or a lower body session that's more endurance-based. But that really is determined by what sport you are involved with. Okay, nothing that happens on a Tuesday should interfere with probably the most important day of the week, which happens to be Wednesday. And the reason why that is that Wednesday is game day or speed day. And again, the most important aspect of any sporting activity is the amount or the ability for people to produce speed or reduce speed very, very quickly. So what we focus on here is 2 hours of practice where speed is the priority. And in speaking to a lot of coaches, we understand from them that it's not always an optically beneficial session. It doesn't always look good because they're large breaks, they're long breaks, there's high intensity activity where speed is the focus. And certainly nothing is done at half pace. And what I see in the on-field training of a lot of our athletes and of a lot of our sportsmen back home in South Africa, there's a lot of sort of mediocre, there's a lot of sort of that oxygen independent focus, whereas the resultant, the sport itself requires high intensity compounds, high intensity ATP, creatine, phosphate, energy systems. It's that work that will determine success or failure. And yet our practice sessions seem to be more in the oxygen independent system. So on game day, on game speed Wednesdays, our priority here is absolute speed at intensity as much as we can. One of the reasons why I've gone into this is because playing at speed appears to be the holy grail in sports. So Vince Lombardi is a coach that I follow. He's a very, very well-known NFL coach, and he coached many teams to national championships. And him, with a whole lot of the other coaches in that area, have also said that playing at speed seems to be the thing that determines elite from moderate or average performances. So if we move on through the week, we then get to game prep Thursdays, and these are 90 minutes of pure practice. So that's just practice, it's structure. All right, so whatever your game is, it might be structure. If it's cricket, it might be working on your bowling technique. It might be working on your away swing or your batting technique. It might be working on your defensive structures. There's some structured play in terms of getting the right movements involved, making sure that the body is moving in the right ways, using the right motor patterns. And you also do some opposition focus here. So if there are sports that you're involved in where you are looking at the opposition and you know that the opposition has a defensive structure like that or an attacking structure like that, you work on your structure in that day. And then finally, on your game prep Thursdays is your upper body or weights room in the afternoon or evenings. So we have Super Speed Fridays, which again is 60 minutes of high speed game prep. So again, these are highly suited for ball sports and for team sports, but I think the emphasis here must be on the high speed game preparation. So if you are running moves or if you're running line movements or anything like that, everything must be done at absolutely high speed. Again, I watch football training locally, and I see a lot of our coaches and a lot of our conditioners are allowing it to look good. So it looks good where we're passing the ball from one side of the field to the other. But the reality is in game situations, those passes have to happen a lot quicker. Our minds need to work quicker. Our bodies need to work faster. So the focus on a Super Speed Friday is to really work high intensity. These are choppy practices with lots of rest between the runs. And the reason why is because you need that recovery before the game happens on a Saturday. If we look at a lot of sporting codes, probably soccer is the one that best utilizes this. I had an opportunity to watch some of the ISL games when I was there, and I know that they also train on a Friday, and their practices are between half an hour and 45 minutes, but really, really high intensity. So there are some sports out there that are, excuse me, that are using this principle, but we don't do it at a lower level or in a lot of the other sports. So with this, the Super Speed Fridays, the focus is on low dose, but very, very high energy. All right, the idea here is you've got lots left in the tank. So it's a very short session. It's just to energize, it's to activate muscles, it's to get the neural system firing, and to ensure that all our athletes leave that session with lots left in the tank. An important aspect here is that we need to also understand that game days, or Saturdays in this instance, are the hardest workout of the week. And very often we don't account for those workouts. We don't account for those games as workouts. And obviously on your game day, you leave absolutely nothing in the tank. So you are absolutely exhausted from that session. And generally after game days, we do find that there's a 48-hour hangover. And the 48-hour hangover gives you a rest day on Sunday and a rest day on the Monday. And that accounts for our training week. It's a very brief introduction, but hopefully if you can understand the principles of the undulating periodization model, you can start including this into your systems, and hopefully there will be more opportunities for me to then discuss the types of activities that you should be doing and the nature of the exercises and the choices that we could then be making around the periodized model. Thank you very much.
Thank you, Andrew, for an excellent talk, very practical and thanks for sticking on the time. That gives us more time for discussions. I think we'll have questions now. Dr. Thiagarajan, can you put up the questions, please, for Janine and Andrew?
We have a lot of questions, so we have shortlisted a few questions. The first set of questions would be for Janine.
Can you hear me?
Yes.
By waiting for the questions to come.
Oh, okay.
So we have the first question from Australia. Patrick Fahad, he's asking, is there a high quality prospective study showing that TA and stabilizer segmental training, which can reduce the incidence of lumbar stress injury in fast bowlers? Janine, for you.
Hi, Patrick. Thanks for the question. No, actually, there are a couple of studies that show that training it in injured players can change, for example, the cross-sectional area or impact pain, but certainly not a prospective study with regards to injury prevention. That certainly would be, yeah, a lovely study to have. And actually, it's a very interesting question because very often we really talk about segmental retraining as a rehabilitation process. So once somebody has actually been injured, and we don't actually look towards it being a potential mechanism for reducing the impact of injury. I think one of the reasons being is that very seldom do you see in any screening batteries that are done that local stabilizers are actually assessed in any of those screening programs, partly because they are really quite difficult to assess in big programs. So yeah, very valid question. Certainly something I've used clinically, but yeah, the studies are still needed to support it.
Okay, thank you, Janine. The next question is from Aditya. Is lumbo-pelvic stabilization alone sufficient for lower back strength?
Okay, so hopefully from the end of the talk you would have could have taken that definitely not. Stabilization is a small component of a much bigger program to improving strength. The segmental stabilization is not something that dominates my programs. I always make sure that the transverses can be isolated. I find it facilitates a better segmental control. So it stops the hinging of, for example, into extension when they hinge on one level. I find recruiting the stabilizers definitely facilitates that segmental spread of load to the different levels far better. But strengthening is absolutely critical. And I've given a couple of talks around our strengthening programs for fast bowlers and actually sportsmen. And I think strength is absolutely critical. I think a lot of our sportsmen, I look at some of the cricketers I work with, are really not strong enough. Their global muscles are not strong enough to deal with the load that they have to do time and time again. So definitely stabilization is not enough at all. You have to strengthen the global system and you have to strengthen it well.
Okay, Janine, thank you. The next question is from Chi Yong Chin. What's your approach on non-specific chronic low backache and central sensitization patient?
Okay, yes, so non-specific low back pain. Okay, so I think it's a very a similar approach. Obviously, the different components of it. When somebody has a central sensitization, I use a lot more education, so a lot more time spent on education around pain and chronic pain and the impact of chronic pain on recruitment of muscles and sensitization to certain movements. So I would say the components of my rehabilitation program are similar, but different parts of it will be emphasized. And I think that stands for any patient, really. You could have two sportsmen with the same pathological or maybe diagnosis, so their diagnosis is the same, but the components of the program, whether it's more education, more stretching, less stretching, actually differ between individuals. So I would say that, yeah, the approach to back pain has a lot of the similar components, so the building blocks are the same, but that we will emphasize more depending on whether there's more a central contribution to the pain, or if it's more of an acute onset low back pain.
Thank you, Janine. The next question is from another doctor asking for suggestions of preventive strategies for lumbar stress fractures, especially in cricket fast bowlers who are young.
Thanks. I think I know who's asked that question. All right. So I think one of the, certainly working with the fast bowlers back home, one of the biggest strategies for me has been strengthening. Obviously, we always start with an aspect of stabilization. And one of the reasons for that is I want segmental control. So if I do something like a loaded squat, the patient isn't squatting into a hyperextended position. So I will always start with a stability component, but we have really been pushing strengthening so that they can deal with the load of each impact, and improving the endurance capacity of our cricketers to be able to manage that. Put that with also just monitoring bowling load. I work with a lot of adolescent fast bowlers, and it becomes really tricky once they've made a provincial side as well as their school side. So it's to try and balance the workload between the two, and to keep an eye out for spikes of load and stuff like that. We monitor sleep because sleep, obviously, as I've indicated, has an impact to play as well. And the recovery from bouts of exercise. But I'd say at the moment, I would say strengthening of the global stabilizers has been, of the global movers has been one of my main focuses in the groups that I've been working with more recently.
Thank you, Janine. And the next question is from Dr. Grace, Tamil Nadu Sports University. And it's more of a general question. During this lockdown, the athletes are not training, or minimum fitness only they are doing. So how they are going to cope up after this? Do you have any recommendations?
Yeah, I think this is going to be a very interesting time. So I think we've got a combination of things happening. So there are some athletes that are actually working really hard, but they're working hard on whatever component that they can do in their home. So we've got a couple of athletes that are really pushing the strengthening component because that's been a whole lot easier for them to do in a confined space. And cardiovascular is going to be the problem. So I think what we're going to have to do is when we all get back together again, we're going to have to see what different athletes have been up to. Because I've got a couple of athletes that I've been working with that are actually working particularly hard and will come out of lockdown quite well recovered and strengthened, which is something we were battling to do in season. And their cardiovascular system will need work, whereas others have been unable to do either. So I think we need to, number one, evaluate the teams to see where individuals are. And I think that's really where we're going with sports medicine, is actually, we've got to stop looking at it as our team as all being the same, and coming out of lockdown is going to be no different. Some athletes are going to be more conditioned than others. And we're going to have to put a structured stepwise approach to getting back to the baseline that we want for them.
So Dr. Thiagarajan, any more questions to Janine? Maybe take one last question for her, and then move on to questions for Sandhu.
Okay, so should I look at those questions?
Yeah.
Childhood trauma and the relationship with...
More of psychosomatic than...
Oh, okay, psychosomatic. You know what, I think we have to always look into that. And I think that's, when we look at psychosomatic components, we look at, I suppose, a more central component. And I think we always need to look at that. I always go back to an example of a fast bowler I had who had a stress fracture. So he had a real an issue with his back. But the rehabilitation process we were going through was not, his back pain was not improving. And actually it took a session where his mom didn't come to the rehab with him for him to admit to me, he hated cricket and he just wanted to give it up. And when we could actually facilitate that conversation with his parents, his back pain improved immediately. So I've always been very aware of psychosomatic, and I think I'm really not, I don't know if that's even the right word, but there is often a central component, whether it's fear, whether it's not wanting to participate in what you're doing. And often what we find is when our clinical findings don't match what the patient's subjective experience of their pain is, that we have to start looking into areas like that and finding support for those. I can't say I've ever really seen a pure psychosomatic low back pain in any of the young adolescents or athletes that I work with. But there is a component sometimes that does influence their response to pain.
Okay, Dr. Janine, thank you very much for all patient question answers. And we move on to Mr. Andrew Gray and his set of questions. So start with, again, Dr. Grace. She has this question of any relationship between metabolic training and the growth hormone, and if the metabolic rate can be increased during or after exercises.
Sure, not that I know of. When I refer to metabolic training, I refer more towards the energy systems that we use to generate energy, as opposed to whether or not it promotes growth hormone or any other substrate information. I wouldn't know. Other than that answer, I couldn't really answer that question for you.
Okay, we can move on to the next question, Thiagarajan.
Yes, and Dr. Sai has this question of the classic curve of training stimulus load causing supercompensation, adaptation, and recovery. And do you think this curve and timing under the curve varies depending on the type of stimulus, such as concentric, eccentric, cardiovascular, or skill training?
Yeah, I think definitely that area underneath the curve is definitely influenced by the type of training. It's definitely influenced by the intensity of the training. It's also influenced by the state of the individual that is going through the training. So whether they are fully prepared, it's got a lot to do with the history as well. So whether they have a 5 or 10 year strength history as to what their adaptations will be like. I think Dr. Janine also highlighted the fact that it's also got quite a bit to do with their sleep. And whether or not they're well rested. So, and that's the problem. It's a very much an individual component that is determined by a number of factors. And I think that the issue for us as conditioners is to make sure that we don't just blanket an approach and say, right, everybody needs 48 hours recovery after this type of exercise session, but we need to look at individuals and see how they respond better. But certainly from my aspect, in terms of this metabolic training, if we're going to fatigue an energy system, we can be assured that after 48 hours, that energy system has recovered suitably enough, and then we can stress and fatigue another energy system after that.
Thank you, Andrew. The next question is from Dr. Vignesh. Your take on concurrent training. Can an athlete adapt to both resistance as well as endurance training at the same time?
Certainly, I would definitely see that all our training needs to do that, especially if the sport that they're involved with does have an endurance component to it. So again, you need to look at what the physiological bases of your sports are and work out what the energy systems are. If we use squash as an example, a squash game over a 2-hour period, you have rallies between 5 and 20 seconds. So that's really high intensity sport. So your endurance components should be based on what the energy system's requirements are within that sport. And again, if you're using squash as an example, there's a high amount of strength that you need. There's a high amount of eccentric strength, because you're probably doing in a game, in a 2-hour game, if my memory serves me correctly, you're probably doing about 1,000 eccentric movements. And those are deep lunges eccentrically. So if you look at the strength component and you put that together from an endurance and a speed and a power perspective, definitely you do need to train them concurrently. You need to train them all at the same time, because that's what the body needs. It does require that to happen.
Okay, Andrew, thank you very much. The next question is from Dr. Amar Singh about the Premier League soccer. How to monitor the training of a desired system when managers add tactical training with strength and conditioning?
Well, what they do is they use various devices. I know in English football, they use a system called Catapult, which gives them live data. So if ever you watch an English football practice, all the players have these Catapult systems attached to them, and it gives them live data about heart rates, systems, energy systems that they're using. It gives them a lot of information about it, and it's based on that. So there's a lot of feedback. There's immediate feedback that the players get as to what energy systems they're using. And then those sessions are also used to then plan further sessions. What happens in English football, though, on the first day of training is that everybody gets assessed or evaluated. And then we've tried this back home in South Africa with a thing called the SHIMS test, which is a recovery test, to try and get an understanding of what everybody's baseline recovery is like. Because your recovery is going to be different. Again, if you've gone out in the evening and you maybe drunk a little bit of alcohol, or you haven't slept well, or if you've traveled in the most important times, you might get to your training session on the Monday and Tuesday and not have recovered well enough. And those systems allow us to identify, systems like Catapult, like SPS, they allow us to identify the recovery ability of that individual, and then what systems they are then working in that training session.
Thank you, Andrew. And probably the last question is from Bhuvana about the undulating periodization. Could it be used during off-season?
Yes, definitely. And one of the best things for me about the undulating periodization model is that all that happens is you still have your parameters of speed, hypertrophy, strength, whatever the sport requires, but your interval sets and your sets and your repetitions and the way you devise the program is based on a pre-season model. So in that case, your speed sets might be slightly slower. They might be a little bit shorter. You might not have as many, but as you get closer to the season, you're then still working within that physiological parameter, but you're now working more closely to what the requirements are of that particular sport. So it definitely can be used pre-season.
Okay, Andrew, thank you. That brings us to the close of the question and answer session.
So thank you very much for Dr. Janine Gray and Dr. Andrew Gray. And again, on behalf of IASM, I extend our heartfelt thanks to you all for taking time off a difficult time. And so stay home. We are going to the next talk in our session by Shrikant Iyengar. And it's my, Thiagarajan, can you put this slide?
Yes, I am doing that.
So Mr. Shrikant is an experienced sports physiotherapist who has worked with men's national hockey team for 7 years. And he has done a master's in sports physiotherapy in University of Curtin, Perth. And he served Indian hockey team during Olympic Games at London, and Rio, and Commonwealth Games and the Asian Games and so on. And he represented the Asian Tennis Federation for the Asian Games in 2018 and represented Ghost Press Foundation for Para-Asian Games in 2018. Shrikant, please go on to your lecture. You need to unmute your, Shrikant, you have to unmute your, yeah.
Can you hear me now?
Yes,
Yeah.
yeah.
All right. Sorry for the glitch. Thank you so much, Professor Arumugam and Professor Thiagarajan for the gentle introduction. I would also like to thank IASM for giving me an opportunity to come and interact and speak in this topic. Thanks a lot for Dr. Janine and Dr. Andrew also. They have really set the floor. I mean, they've set the ball rolling, because I think it just allows me a good launch pad for me to take my topic further. So just getting on to the topic, I have a few acknowledgements to make. I have no conflict of interest to speak in this topic, and I have taken some resource material for educational purpose from FIFA medical program and from online, International Olympic Committee Medical Commission for my preparation, as well as clinical sports medicine book from Bruckner and Khan. So now, if you don't take anything from my topic today, just take these just take these 6 points. That's all. First, that the adolescents are not young adults, so they cannot be trained like adults, right? They are unique individual, need to be respected in that manner. Number two, musculoskeletal age should be given precedence over chronological age. That means if biologically somebody is 13, maybe his musculoskeletal age is still only 10, or maybe he's already 14. So you always have to think about the gone age in terms of training and loading. Third thing would be think beyond performance. So it's not just about winning a medal at the Olympic Games. It is also about having a quality of life which involves good physical literacy, and go on to live a life which is more satisfying and fulfilling. So think about long-term athlete development. Number four, even if they're adults or even if they're adolescents, be inclusive of the athletes in the program. So it should not be like a hierarchical model that one way. It has to be inclusive of the athletes in the present time. Number five, which has been already kind of discussed in detail by the previous two speakers, is multifactorial reasons may require multi-model approach. So you could have more reasons for a young athlete to get injured, and we need a multi-model approach to manage that. Number five, primary movement patterns, that means fundamental skills of throwing, jumping, running, rolling, should always be superior to sports-specific skill. Right? So where did it all started? It was basically in Eastern Europe in 1950s to 1980s. We saw that post-World War, there was a lot of devastation because of the war. So they thought, okay, now only sports becomes a way where you can start to show your prowess to the world. So some of the Eastern European countries, they started to see that there's a trend of young gymnasts or young swimmers or young figure skaters doing well. So it suddenly went to a kind of a situation on the role that, if you want to achieve success, you have to start early. It almost went until late 80s. Now the legacy, and that philosophy gave birth to some genuine legacies. So Tiger Woods was given the first club at the age of 2. Andre Agassi started playing tennis at the age of 4, and Martina Hingis played her first competitive tournament at the age of 6. So this is how the things continued to progress more and more. So what did the legacy do? It led to an early specialization model. That means you have to start early. You have to start training one model, one game more seriously. There was year-round training which started. That means there was constant training, constant playing of one particular sport in a more serious manner. It also gave way to an organized or more coachable way of training, and that it led to the production of baby champions, right? So now, what was the reason? What was the logic? So the coaches started to believe that the foundation of early virtues like values and attitudes and belief system are established sooner in life. That means they also thought that probably if we delay on to adopting a child into a program, that means the chances of his skill development will be poor. The chances of him being disciplined will be poor. The chances of him being able to push physically will be more poorer. So the early start provides a greater challenge, the chances of success. That was a theory which was very, very, very elaborate. And then it came a landmark paper by Professor Anders Ericsson, who was a Swedish psychologist. He came with a 10,000 hour rule. He had examined a set of violinists, and he saw that people who really went on to become great musicians had at least 10 hours of practice, which was deliberate practice. That means it was conscious, there was no element of fun, and every single day they continued to do the same thing in the most serious manner. What was unfortunate was that continued to go on to be adopted by arts, adopted by the field of science, and adopted by the field of sports. And then there was books like Malcolm Gladwell's Outliers, which kept on over highlighting the thing that if you want to achieve success, you have to have minimum 10,000 hours of practice. That means minimum 3 hours for 10 minimum years of your life. That meant that if you have to win an Olympic medal at the age of 18, you have to start earlier. So that's where now we see that the AOSSM have come to a consensus couple of years back, and the consensus statements established that what was the definition of early sports specialization. So basically, participation in intensive training and or competition in an organized sports greater than 8 months or more. That means you're playing one sport in one calendar year for more than 8 months, right? And the participation of one sport is with exclusion of any other sport. That means you should be only playing one sport with no inclusion of any other sporting situations. And number 3, it should be pre-pubertal. That means the child should be less than 12 years old. So this was a definition given to early specialization. So now when we see there's a lot of benefits, what the coaches and probably the sporting administrators or sporting world was talking about, there was some risks also, which was early peaking. That means there was a less consistent performance beyond a certain point of time. The child had reached his potential too soon. That meant that they wanted to quit the sport sooner, right? There was greater risk of overuse injuries and burnout following any early specialization. So that means the kids were starting too soon. So by the time they reached 15 and 16, they were already burned out. They were not willing to push themselves anymore. And it may inhibit overall motor skills development. So what is happening now, right? Adolescent participation in sports is getting more and more popular. We see more and more parents wanting to see their kids playing and doing well. So now since it is gaining so much of popularity, it is imperative for us to understand the specific physiological characters of each child, depending upon each sport, depending upon the sex, depending upon the bone health. And most importantly, thinking about the injury prevention guidelines. So now what happened was NCAA came out with a very beautiful paper a couple of years back, which showed association of early sports specialization and high training volume with injury rates in National College Athletic Association. They took Division I athletes of various sports. It was multidisciplinary sports which was taken. And they came out with one thing, that one of the major reasons why the kids started to play earlier meant because they would become better sooner in that age group. That meant that a bigger scholarship. But what also meant was, because they were training more, because they were starting early, the training volume was much higher. That meant that most of them got injured. The athletes who started earlier basically started to face more injuries. So that was a very important information for us to give way for understanding what is the uniqueness of a young athlete. So basically, we all know now that engaging in sports in adolescents have numerous health benefits, but we also know they are vulnerable for injuries. They are not fully grown up adults. And it's not just the physical injury we are talking about here. It could be psychological, it could be emotional, it could be overall well-being of an athlete. So injury risk factors had to be completely unique to this age group. Right. So what is the basic, when we keep saying they're unique, what is the uniqueness of that? That means there's a non-linearity of growth. Different stages, when a child is born till the point he reaches his complete puberty, he is going through a series of changes. That means in the initial phase, your head and neck is bigger. Then as you start to grow older, your long bones become bigger. And then the musculoskeletal, the muscles are only following the skeleton. And at that point of time, the loading has to be variant in terms of what is happening in each stage. Same thing, there are maturity associated variation. That means not all the children of 12 years or 14 years or 16 years will be of same height, same girth. They will grow differently. Adolescent growth spurt. So you see the bottom line on the right side, you see at different stages, you're going to peak up onto your peak height velocity, and you're going to keep growing taller and taller to the best of your genetic abilities. The next one is unique response to skeletal injury. We know that the green stick fractures are very, very unique. The cartilage injuries are extremely unique. The damage to the osteophytes are extremely unique. The vertebral end plates can have completely non-reversible changes in this age group. So it becomes very, very important for us to understand the loading. And then the most important factor which we undermine is immature and underdeveloped coordination, poor skills, and more intense training session. That means if my skill levels are not strong enough, my coordination is not strong enough, and then fatigue also sets in with too much of training, I am actually pushing my child to 100% go into a situation where he's going to get either physically injured or psychologically burned out. So it's very important to understand what is the uniqueness of this thing. Maximum studies in the junior program has come from football world. So epidemiology of football world suggests that 50% of all registered footballers in the world are of 18 years age or less than that. That makes out to be 150 million players per year. And that means if you have minimum 2 injuries, low intensity, moderate intensity, it becomes 300 million football related injuries in one sport alone worldwide. Just think about not just the physical side of it, the amount of time away from the sport, the overall gamut of things required, the parents going under stress, the coaches getting frustrated, the whole medical team, and the most importantly, the financial and social aspect. Because as it has been discussed by Janine also, sometimes the fear of injury is so high that the athlete might never come back to sport ever. Even if he wants to, we all know that anterior cruciate ligament injuries or high intensity hamstring, high grade hamstring injuries means you will never come back to your full potential of athletic potentials. So it is a matter of concern. 77 or so SafeKids.org did a study in 2013, and they came out with the very startling information that 77% of parents were expressing concerns over child's sporting injuries. And 47, and they thought that it's actually coaches' responsibility, and they also thought that the coaches knew what they were doing. They also knew the idea of injury prevention. But 47% of that population of the coaches suggest that either we do not have sufficient time or we do not have sufficient training. Of course, they are trained to do first aid and CPRs, but to understand proper load management, injury prevention was not their domain. So that means this is what it is. Injuries are not just bad luck. So if we are not falling a child into a complete domain of good periodization cycle, this is what is going to happen. And then we might not be able to blame just the luck alone. So what is a simple thing? This picture itself is self-explanatory. Till the time your training loads are lesser compared to the capacity to bear or handle the load, you're going all right, right? The moment the training load starts to become higher, the capacity to handle load starts to reduce. Now, mind you, this is a very continuum model. That means depending upon the cycle, depending upon the phase of a season you will continue to keep monitoring it and adapting to it. So pre-season will be different, during seasons will be different, and later stages of the season will be completely different. The biggest factor is to monitor and adapt. So now, what is the reason for risk of injury? It has been taken very well explained by my previous two speakers. I would just like to add upon a couple of more ideas. So let's say training and competition load are extremely important. I firmly believe if you do not train to a certain intensity, playing a certain competition or a match of a certain different intensity is highly, one, it's not right for your overall performance basis, but it really predisposes to a major injury predisposition. That means if you do not train high and you want to compete high, you'll never be able to achieve your maximum potential. Number two, constant increase in spikes of load. That means too high loading doesn't allow for recovery of a child. Number three factor is suddenly having no history of training, so too much too soon. That means you expose a child too much to a bigger level of competition can also have a big impact onto the training and competition load. And the last point is the difference. It's the association between acute and chronic training ratios. That means it has to be adaptable, more so in adolescent athletes and more so in injury athletes who are coming from injury. Competition schedules. We all know now that the athletes in schooling arenas are crammed up. Either you do the competition in summer vacations or you end up doing in Christmas vacations or in Diwali vacations. So you end up playing a lot of games in less time, and that also probably the child is not able to adapt. Training schedules also, too much of matches in one day or in 1 week, it's not the right thing. Same thing, the training schedules have to be monitored or altered based upon pre-season, during season, and off-season, and also lifestyle and well-being. So do not take it away that they are still school-going kids. They could have academic pressure. They could have pressures going through a social causes of they being an adolescent or a teenage child. It also could be generally, factors around home, the emotional status, what is happening with the child to his personal and professional situations. All of those factors needs to be considered. Then the other factors would be sleep and nutrition, as well as the most important thing is the enthusiasm of the child to continue to have fun while playing. The moment the fun aspect goes off and it becomes too serious an affair, most often than not, the athlete doesn't respond well to the training volumes. So what can be done? A simple strategy like this can be used, right? Whatever you taking any kind of walking, bicycling, or fast walking or medium, so you can distribute that into a simple scale. A child cannot really say that how much is high or low enough. But if you can slowly encourage him by using a small scale to understand green is good enough for you, red is not good enough for you. When you start to feel, the rate of perceived exertion is too high, you're too sore, you don't feel too enthusiastic, they can actually start to equate down by a simple measurement of scale like this. And this could be done for myriad of training programs and schedules. Right. So now this is what, so once you have monitored it, this is where it needs to be managed. You need to give a progressive thing. So you obviously have to alter high and low load weeks. That means there are certain ways you go. First week, second week is a little moderate, and the third week could be higher. But the moment you've given high load, the fourth and fifth week has to be managed down below again. Now, the right side of the graph clearly shows us that how incrementally and prospectively the child can be taken ahead if we keep continuing to manage these things well. Again, mind you, there could be injuries, there could be academic situations, it could be, generally emotionally, the child does not feel too good. Respect all the situations, and that's how it needs to be a continuum model for us to be adapt to the situation. This was one of the beautiful paper which I wrote, which I got from Professor John Ekstrand. He's one of the gurus of football medicine. Now he has come out with this paper that is there a correlation between coaches' leadership style and injuries in elite football team. So it said that there was a negative correlation with the team wherever the coaches were they displayed high leadership qualities. Wherever they were more empathetic and they were more inclusive of the athletes, the injuries were much lesser. Which was the opposite case, where the coaches were too hierarchical, where the sports medicine team was not given the due reverence in terms of managing the injuries. The injury levels were much higher, and with no logical thing, the teams performed poorly. So this is a good paper to read. So now that takes me further, to what is, if we understand that injury is a problem, load management is a problem, so can we have a formula? So long-term athlete development, a very good specialist group of expert group of people from Canada had devised this. So basically it just gives you a framework for optimal loading, competition, and recovery schedule. Right. So that was, it just simply puts it across that there has to be a physical literacy, which should be given to a child at the earliest of his life. That means he can start to do simple things like running, jumping, throwing well. Those are your primal movable patterns. Now that can give a strong foundation for him to take up any particular sport in the future, professionally or at an elite level, or at least continue to have physical association with physical activity through the rest of his life. Now, the most important factor which came out that your fundamental skills of running, throwing, jumping, rolling should be acknowledged by year 12. Otherwise, the child cannot reach to his full genetic potential. If it can still have some value post 12 years, but it has got the maximum value if you start earlier. So now what it means, LTAD, it involves 8 to 12 years of training to reach an elite level. It gives you a framework. This is what is required minimum. So US Olympic team did a very good study in 2001. They had taken 3 Olympic cycle of 88, 92, and 96. What they deduced out of that study was it takes 0 to 13 years to make to the Olympic Games, and it takes around 0 to 13 to around 15 years for winning a medal. So that's the kind of time what we want. And it depends upon sport to sport, athlete to athlete. Right now, LTAD. So simplistic, what it is doing, it is giving and establishing a core set of motor skills. It is helping us establish positive relationship to physical activity. It helps in improvement of motor and cognitive skills and improvement of longevity and quality of life. So sets the thing up for us. So basically it involves 9 stages. That is active start, then it's fundamentals, then it's learning to train, training to train, learning to compete, training to compete, learning to win, winning for a living, and active for life. So I'll just quickly go through each stage. Stage 1 involves active start. That means the age has to be, for males has to be 0 to 6, females also 0 to 6. This is where unsupervised physical activity is done, where the child doesn't have to be coached. He's just doing 60 minutes of continuous some kind of physical activity. Now we just ensure that we involve running, throwing, jumping, or wheeling for a wheelchair athlete. And we do make this as a part of their daily routine life. Right now, stage 2. Fundamental stage, which is a fundamental stage 1. That means the age is around 6 to 9 for males and 6 to 8 for females. Now, this is where your agility, balance, coordination, speed is to be introduced. This is where a coach can come into the play, but you continue to let them have fun just by incorporating ABCs into the into the training program. Stage 3 is where the males are to be 9 to 12, females are to be 8 to 11. This is where some sports specific component of the sport you want to play is incorporated, but continuing to enhance your ABCs. And then an integration of physical, mental, cognitive, and emotional components are also included in this. Stage 4 comes down to the age of 12 to 16 for males, 11 to 15 for females. Now, what is objective here? It is to develop endurance and strength and speed. Now we understand the basics are set up. Let's try and push it to a little bit of more higher volume of training, which is setting up a good base for endurance, good strength, and good speed. And this is where your athletic specific skills and fitness are introduced. And stage 5, it's learning to compete. That means the challenge of competition, taking up that, that the butterflies thing in the stomach, the psychological pressure, the nervousness, this is where it is introduced. The males have to be around 16 to 18, females have to be 15 to 17. Now, this is where you start introducing sports specific protocols. This is where your strengths and weaknesses are identified. And this is where your implementation of event specific specialization starts to happen. Stage 6 is, by this time it is training to compete, heat of the battle. The athletes are already grown up. It optimizes the event specific preparation. We start to do a little bit of more refinement of the specialization, but you still continue to integrate physical, mental, and cognitive and emotional development of an athlete. Stage 7, it's learning to win. This is where your athlete is actually completely grown up to take any championship. He's already grown up, or he or she is grown up. This is where your maximizing of high performance comes into play. And we introduce a formal performance enhancement team, more people in the system, and to learn and compete when it counts. Stage 8 is winning for living. This is the life of a professional athlete. This is where he needs to perform, and it really matters a lot. The males are 23 plus minus above, females 23 plus minus above. The objective is to maximize event specific preparation, winning the medal at the Olympic Games, winning at the world levels, world championships. And then the most important factor for me is stage 9, which is active for life, dealing with adversity. So if it's a professional athlete, we make them to integrate back into the life. You're going to be retirement, post-retirement stage of athletic life. If you don't make it to be an athletic, professional athlete, so how you can continue to be active and continue to bear the fruits of physical literacy. And this is the idea of holding stage 9. So summary, LTADs, it produces athletes who reach their full athletic potential, as well as experience success against competitors from around the globe. So if you can just take 3 take-home message, let the fun element continue to be alive. Do not take it away from the children. Michigan Institute of Technology, 3 years, I think back, they came out a paper that the top 10 reasons for our athletes to play sport, and none of them was winning. And all of the first thing was the fun element of the sport. So let the kid enjoy the sport. Physical literacy is the key for the rest of their life of maintaining a good quality of life. And third thing is quality of life is crucial, as is sporting triumph. Thank you so much for listening.
Thank you, Shrikant, for a nice lecture. And just to stay on, we'll get the questions at the end of the next talk. It's my pleasure to invite the Sonika Sudan. She is a licensed physical therapist in the USA and the first Indian female physio in Asia to be awarded AFC President Traveling Fellowship in Football Medicine. She has worked with Indian women Olympic hockey team and football teams, traveling with them to various national and international events, including Olympics. Yeah. Sonika Sudan is all yours now. You're not audible. Can you check your mic? Sonika, we're not able to hear you.
Sonika, still your audio is not coming up. So should we post questions to Mr.
Yeah,
Shrikant?
we can ask questions meanwhile.
Yes. Sonika, you can stop sharing the screen till the audio is sorted out. We'll project questions to Shrikant.
Yes, sir.
Yes, Sri, the questions are many, so I've just picked up a few.
Sure.
First is from Chiong Chin, your good friend, it seems. What's your approach in load monitoring during and after peak height velocity?
So it's a very good question. It's a very good question. There's no authenticated study to say that during the peak height volume, we have to anyways reduce the training volume. I think we just have to maintain it and we have to monitor the symptoms. So you can continue to load the child even during when there's a peak high PHV is happening. But we just need to ensure that if any kind of enthesiopathies or any kind of systemic problems are coming, then we just have to manage it symptomatically. Otherwise, if you have a graded exercise plan, which the child is already doing it, that means you don't introduce a new exercise to him. But if he's already doing an exercise plan, he will actually end up, there'll be a positive impact to his overall PHV. The only thing you have to be mindful about, any kind of technical training should be avoided because the child is going through a growth development. That means the proprioception could be affected. So that means imagine if you are a golfer and you have learned a technique in a certain manner, now suddenly your limbs are becoming bigger. So how do you, it'll be a little bit of a confusion for the child to manage. Yeah.
Okay, Sri, thank you. The next question is from none other than our former hockey captain of India, Mr. Sri Bhaskaran, about how well our Indian athletes are equipped with injury, especially scientifically, to accept the advice of physio and the medical staff. His second question is there any Hindi version of any learning literature for them?
Fine. So I think it's again a very good question, sir. I would say that in last decade, I think we have come a really long way ahead in terms of where Indian sports scientists or Indian sports physios and doctors are there. I think organizations like CS have done extremely well in terms of getting good professionals on board, also with good educational program. What has happened, I think there were a lot of physiotherapists who've come and started working in India through either IPLs, or a lot of physios have gone and studied outside. So I think the exposure of that high quality physiotherapy or sports medicine care has already come in now. The only thing what is lacking right now is the integration of those experts into the system now. So either so problem is everybody feels that I want to only work with national team. The only problem the only thing which you have to start to encourage the physios and young doctors is that as the athlete takes 10, 12 years for him to reach to the Olympic level or highest level, I think the physios or physios or physical education coaches have to start working in the grassroots level so that the interactions can start to happen more. Athletes can be educated at the earliest level. Physios and doctors also can end up growing their trade better in the junior program. Now, talking about Hindi materials, I would suggest that much of the evidence comes from the Western world. So unfortunately, yes, if we start doing research within our country, we should be able to document it in Hindi. But I would say it's a very small hiccup because, like, let's say all your scriptures, if that can be translated into Hindi, it's very easy to be translated into this language. It's perfectly fine. I think to just a module, if we can make it, we can always translate that into Hindi for the athletes to have them.
The next question is from Sargam. Any specific training program for the adolescent fitness?
I think Andrew spoke very, very smartly about different training systems. And that's why I would be worried about whenever somebody says any specific training program, it'll depend upon what age group are you talking about, what sport are you talking about, what male, female sex is, and then thinking about different stages of a program. Are they into full sporting program? Are they into a day scholar program where a sport is happening couple of hours in a week? So it'll all depend upon what is the need and the criteria. But the biggest thing for me is to continue to have your agility, balance, coordination, and speed. And then your primal movement patterns of your rolling, throwing, jumping, running, these should be on the topmost criteria before the child is at 12 years. Because then that really gives you a platform to build up good strength, good endurance, and good speed component in the future life. So I think, yeah, you need to take into perspective in terms of who are you dealing with.
Thank you. The next question is from Neha. Is there any way of checking the musculoskeletal age of athletes, is she asking, very debatable topic, without medical x-rays and all these things?
Look, there is no other way apart from medical x-rays. But one thing I'll tell you, when you use a word called harmful, I can tell you with documented studies that the exposure to that kind of, for getting a left hand x-ray, it's so minimal that you can do it for next 5 years and it's still not equate to be a very high intensity thing. So to say that it is going to be harmful, it has got to do with the belief system of the practitioners than the real understanding of the scientific background. So I think the only and the best way is to take up left arm x-rays by the time you start suspecting the adolescent growth spurt has started. And I think you just follow it for next 3-4 years till the time you're sure that the child has reached its complete musculoskeletal age. But I can promise you, ma'am, that the harmful effects, what you're talking about, it's not really valid. You can also even discuss with the radiologist to start giving exposure, because they can have less exposure and still the information of that particular segment of the hand can still be sought for. I hope I've answered you this question.
Yeah, thank you, Sri.
Dr. Thiagarajan, can we check on whether Sonika's audio is sorted out? We can go to lecture, come back again for the questions.
Sure, sir. Sonika?
You want to use
Yep.
And I think...
Can you hear me, sir?
Yeah.
Yeah, we are hearing you, but there is some echo. So Shrikant has to switch off his audio.
Mute, yeah. I think now you can go on. Yeah.
Yes, I'm sorry.
Yeah, you will. Good. You can share your screen.
I'm sorry for the initial glitch. I wasn't really aware of what's happening.
Okay. Now we're all good to go.
So I'm going to make it to a screen, full screen, and then we can start. Yeah. Thank you so much, sir, for giving me this opportunity to speak. My topic today is relative energy deficiency in sport. And in 2014, the International Olympic Committee had come up with the published consensus statement that female athlete triad should no more be just a female athlete triad, and it should be regarded, it should be actually called as relative energy deficiency sports. The reason being that relative energy deficiency in sport implies, or it refers to impaired physiological functioning caused by relative energy deficiency, and includes, but is just not limited to the menstrual cycle and the bone health, which was the case in female athlete triad. But it also includes impairment of metabolic rate, menstrual function, bone health, protein synthesis, cardiovascular health. So just to give an idea of the female athlete triad, this is a spectrum that defines the interrelationship between 3 conditions, from normal function to abnormal function. The spectrum includes optimal energy availability, optimal bone health, and eumenorrhea. Now, coming to the relative energy deficiency in sport, this is the health consequences. So you can see that there's just not 2 systems which are affected because of the relative energy deficiency, but there are almost 10 systems in total which does get hampered in their physiological functioning because of the low energy availability. That includes endocrine system, metabolism, hemocratic system, growth and development, psychological, cardiovascular, gastrointestinal, and immunological system. Now, this was a study which this is an update of the IOC consensus statement, which was earlier first time out in 2014. And this is the updated version of the same study, which has an elaborative, detailed information of how the relative energy deficiency in sport affects the athletes and their well-being. Now, what is energy availability? To define it, energy availability is nothing but just the energy that is available to undertake or to go through that actually allows the body to do its normal physiological functions. So energy availability is to calculate, you have to, this is the formula that you can use to calculate is energy intake subtracting the energy that is been spent on the exercises. So energy intake minus the energy exercise energy expenditure kilocalorie per fat-free mass per kg per day. This was a very good graphical representation by Dr. Nikki K to show the relationship between low energy availability and its effects. So if you see the first picture on the left-hand side, the first graph shows the reduced energy availability for the life processes. This is intentional low energy availability. The athlete makes an effort to have to take less food and less intake so that they can get lean to improve their performance. So they are hoping to become lean to improve their performance, which is a wrong belief system. Whereas the second graph shows an adequate energy efficiency, energy availability in the body leads to a sufficient energy available for the life processes, as well as it also meets up with the energy demands of the training load. So the body adapts to the increased energy demands from the increased training load. And this is how the balance should look like in an ideal athlete. Whereas the third graph shows, this is a picture of those athletes who are not intentionally eating less, but yes, it is an unintentional less intake of the energy. And what happens as a consequence is that there is reduced energy available for the life processes, and they end up being more tired, fatigued, and obviously get into injuries and reduce performance altogether. So energy availability for a healthy physiological function is typically at 45 kilocalorie per kg fat-free mass per day. Anything less than 30 kilocalorie per kg is actually considered as low energy availability. Now, coming to how do we measure the energy availability in an athlete? Now, there is no standardized or reference protocol for undertaking an energy availability assessment because they are not really reliable and validity. There are always reliability and validity issues. Also, there is great challenge that you cannot really rely on the feedback that the athlete gives you. You are not sure of the accuracy of the self-reported sources. It is difficult to measure energy expenditure during training, competitions, and including additional recreation lifestyle activities because there is it is hard to calculate how many number of calories has been spent in a single training session. So that is why you cannot just rely on the field assessment. You also need some specialized equipment and expertise to help you with when you want to measure the energy availability. You can also use take help of the nutritionist for a detailed nutritional assessment. Can use DEXA scans for checking the bone mineral density. Can check on their body mass index. So there are a lot of different parameters which I will come to later to address how do we calculate it. Now coming to why the first point is why was it changed from female athlete triad to relative energy deficiency? The reason being it's not just the females who do get affected because of the low energy availability, but it is also the male athletes now who are suffering and who have the consequences that relate that are related to low energy deficiency in sports. So these athletes include cyclists, rowers, runners, jockeys, and athletes in the weight class combat sports. Now, we must be thinking what really is the reason that the males are also suffering from this. So there are a lot of factors that contribute to low energy availability in male athletes. That could be clinical changes in the body mass and compositions, making, especially in the weight category sports where the athletes have to maintain a certain weight. So maybe in a day, they have to cut down to 3 kgs to be in a certain weight category. Also, prolonged and inadequate energy intake to meet certain high energy expenditures of endurance sport. So they ignore to eat well, though their trainings are at the same optimal, their trainings are of the same level. Also, there are punctuated changes in, like certain changes in training volume or intensity, participation in endurance events without really considering the diet component. They don't really pay attention to the diet and just go and play and compete. when they don't really take care of what is the pre-competition meal, what is the post-competition meal, and what they should be taking during the competition. So these are all areas that an athlete has to address when they are going for an event. There are a lot of inadequate food availability, and especially in our country, where in India, a lot of people don't eat mutton. There are a lot of vegetarians, and there are a lot of food constraints, including the food insecurity from cultural practices or lack of financial resources. So there are all the reasons why there is lack of energy availability in male athletes as well. Now, this is an interesting area of study now, because as we see, there is a boom in para-athletes, and obviously the para-athletic sport is doing a great job. But there are not much studies, or I must say there is not really any study that shows impact of low energy availability in para-athletes. So maybe we need to look into this and have further research done in this, because considering the disability and the demands of the sports they play, definitely they will also be going through the low energy availability. Now, for example, so these are just the references considering what happens in the normal general population. So say a wheelchair athlete, an athlete who uses wheelchair for the mobility will have a reduced baseline energy needs because they are not really spending a lot. Whereas an athlete who has a central neurological injury, for example, cerebral palsy, will have a high energy expenditure. An athlete who is an amputee will have a high energy needs because they need to set up the prosthetic use, and they're because of alteration in their gait cycles. So if we really go through or we consider all these areas, then we see there is a lack of study and research in para-athletes, and they are at high risk for impaired bone health and bone-related injuries, secondary to many factors, including the skeleton loading, because obviously if they have a lower limb disability, the loading pattern of their skeleton system will be very different than a normal person. Now, coming to the first condition in the female athlete triad is the menstrual function. As we all know, menstrual cycle lasts anywhere between 28 plus minus 5 days. That's a normal menstrual cycle. But if an athlete has less than 6 cycles per year, or if the cycle lasts for 35 days plus, then it is called oligomenorrhea. And you should be considering this and not ignoring it. There is amenorrhea also is of 2 types. It could be primary amenorrhea, where the delay of menarche has happened until after the age of 15, and secondary amenorrhea, where there is no menses up till the month of 3 years. Though the menses have started, but now there is all of a sudden there is no cycle for consecutive 3 months. Then it is secondary amenorrhea. A very good amenorrhea logarithm, which can be used, and it is actually a clinical recommendation to be used by a lot of physicians and the healthcare professionals who work with the sporting population. So they definitely address the history and physical examination, followed by they undergo the initial investigations and the follow-up lab investigations. You have to exclude pregnancy, any disorders of sexual differentiation, or any of the uterine pathology. These findings have to be diagnosed by a physician or the team doctor, but I would recommend if the team physician or the doctor is not really well versed or have any experience in dealing with this population or dealing with these conditions of hypothalamic amenorrhea, then please recommend them to an endocrinologist. Now, the second condition on the spectrum was bone health. Bone health is very important, and as we all know, individual hereditary explains almost 60 to 80% of variation in the bone mineral density. The peak bone mass maturity, especially in females, is around 19 years of age, and it is another influencing factor. The factors that also contribute are sex hormones dysfunction can have a direct or indirect influence on the bone mass. For example, estrogen is responsible for absorption of calcium from the blood and deposition into the bone. So, and testosterone is equally responsible for bone health. So we see that if there is any alteration in the sex hormones, it does affect the bone absorption. Now, this is one of the this is one of the reference point where you can which you can use for using as indication for obtaining a DEXA scan. So if the DEXA scan scores, say the Z scores are less than -1, then they are at high risk. If the DEXA scan scores are in between -1 and -2, they are at moderate risk. So you should be considering athletes who have low BMI or BMI less than 17.5 or less than 85% estimated weight. I mean, like if they are underweight and or they have a recent weight loss of more than 10% in 1 month, they should be considered for a bone scan. If the athletes have a history of frequent stress fractures or multiple fractures, then you should be considering to get a scan done. Now, it's a very good presentation of how the endocrine system in our body gets affected. I'm not going to go through in details of it, but if you see, if there is an energy deficiency, it does affect your pancreas, your pituitary gland, adrenal gland, hypothalamus, thyroid, gonads, and ultimately the bone density drops your basic metabolic rate and also increases the cortisol level, decreases your immunity. So it's a mesh of how the hormones play have worked with your body if you have low energy availability in your body. There are other systems as well involved. I'm not going to go into details of each and every system that is involved, but yes, prolonged reproductive and bone health are only two of the physiological processes which have prolonged energy deficit, and they have a negative impact on your health. If there are any changes in the level, other like cortisol, insulin, growth hormone, IGF, leptin, ghrelin, they all are very important and to carry on the normal physiological processes in your body. So the other systems involved and will have the effects like they will have ultimately prolonged energy deficit will lead to anemia. You'll have low hemoglobin, and you know that will result in chronic fatigue, decreased immunity. I have already mentioned that. Endothelial dysfunction, there will be cardiovascular effects, decreased protein synthesis, so definitely the recovery will be slow, decreased basal metabolic rate, and a lot of psychological effects. A very good picture to show how the low energy availability in our body can affect our performance. So if we really go by this reference, then definitely it increases your injury risk, it decreases your training response, there will be impaired judgment, decreased coordination. And when it comes to judgment, I must say that if you would notice ever whether the player, like towards the end of any match of 90 minutes of football or 60 minutes of hockey, the decision-making capacity of an athlete really drops. And that is when the maximum errors happen. So definitely there is an impaired judgment if there is low energy availability in your body. Decreased coordination, that is why maximum errors happen during or towards the end of the game. But so this is for the athletes, errors happen towards the end of the game only if they are eating sufficient. But imagine what happens to the athletes whose tanks are already empty before they enter the field. So that's where their performance will drop drastically. There will be decreased coordination, decreased concentration, decision-making sense will be really low, irritability, they might undergo depression, decreased glycogen stores, decreased muscle strength, and endurance performance. Now coming to how do we prevent it? So it could be prevented in 3 different ways. It could be primary prevention, where you identify athletes at the beginning and before they actually have any of these symptoms. So early identification will be very important as for the primary prevention. Secondary prevention is once you know that the athlete is suffering from low energy availability, and so you have to find out the ways how to help them to get back to a normal physiological level. And then the tertiary prevention is where you know the athlete is suffering and how quickly you can get them back to the normal physiology. there should be reduced emphasis on weight and body compositions as means to increase the performance. So lean is not always good. That is something that we really need to educate our athletes on. And a good performance does not mean that you have a good health. So how you look does not defy, or how you perform does not defy that you are an ideal body weight. So also, there is a need for multidisciplinary health support here, because only one person of the team cannot really help it. So you need a physiotherapist, psychologist, coach, athlete, medical team doctor, endocrinologist, everybody on the team and everybody on the same page to help the athlete. So this was a screening tool which you can use as a part of your pre-screening, which was published by IOC. So these are a set of few questions that address the issues of your menstrual health, of your bone health, and your energy levels.
I think she's almost done.
So coming to the treatment of relative energy deficiency in sport, it could be pharmacological and non-pharmacological. So I'm not going to go into depth, but definitely the treatment includes, first and foremost, you have to restore the energy balance. The second one is nutritional education and counseling of athletes is very important. They need to be aware that they are energy deficient. You have to focus on normalizing the eating behaviors and body composition and menstrual disorders. There is need for comprehensive counseling by a psychologist. So maybe a coach or the team doctor should not be hesitant to take a specialist help. When it comes to pharmacological management, I will leave that to the experts, but yes, definitely using over-the-counter contraceptives and transdermal estrogen might help. Intake of calcium and vitamin D supplements are useful for bone health, and biphosphates. So if you see on the graph, you can see how much time every component takes to recover. So if you have low energy availability, it can be sorted with right intake of energy and by improving your nutrition. So it takes around days to weeks. If you have to recover from the menstrual dysfunction, it takes months. And to recover from a bone mineral deficit, it takes years. So it is a long process. Now, how do we, the International Olympic Committee had come up with a risk assessment model where they categorize the athletes into high risk, moderate risk, and low risk. If the athletes are in high risk, that means they will have serious eating disorders, they will have serious medical conditions and life-threatening, unstable medical conditions and psychological stress. So they should be excluded from training and put on a proper medical treatment and should not be allowed to play until they clear all the concerns or all the areas in return to sport assessment. Coming to moderate risk athletes can train under supervision with modified training, but definitely they have to undergo and complete their medical treatment. The low risk athletes can train and they can get back to the normal training. There is no problem with that. Now, the take-home messages for athletes, for everybody who's listening, and for all the doctors is that first you need to be aware and be educated about what is relative energy deficiency in sports, because a lot of almost 45%, I will say maybe in India, maybe less than 30% of the sports physicians, physiotherapists, and all the healthcare professionals are aware of this term. So they need to know that this is something very important and prevalent at this point because the sport is really getting competitive. So these are the myths that you have to burst. If anybody comes with you, it is not okay to not menstruate. If you don't have periods for 3 months, please go and see a physician. This is not normal. The ideology in the brains of the athletes and the coaches is that thinner is better for performance. And the less I weigh, the better I perform. But please make them aware that if they have less muscle mass, they will not be able to perform on an optimal level. There are very good studies which are done to justify this point. So you can look for them, or I have mentioned below. It is acceptable to follow a low carb diet. No, for an athlete, it is not acceptable to follow a low carb diet until unless it is prescribed by your nutritionist. So you cannot go low on the carbs as that reduces your fuel tank. But yes, Again, if you have to do it, you have to do it under supervision with proper guidance by a nutritionist. Multiple stress fractures are typical when training. No, it is not typical. And if your bones, you are getting multiple fractures because your bones are weak and they're not able to take the training load. So yes, these are the myths and you need to make them aware with the facts. Thank you. I think that's all for now. Thank you.
Thank you, Sonika, for a nice lecture. Any questions, Thiagarajan?
Yes, sir, there are lots, in fact. So we have coined a few questions, and there are some pending questions for Shrikant. Should we ask him, or he'll go to, since there's lack of time?
Yeah, with lack of time, probably.
Yes, sir. So questions to Sonika now. The first is from Mitra. Energy level changes with the seasons in spite of taking diet exercises as per the advice of physio and dietitians for a cricketer age group of 6 to 13 years. What could be the reason and remedies?
What are the reasons? So first you have to consider the age group that you recommended is 6 to 13 years. So definitely they are growing athletes. So energy demands of the growing athletes always vary as they grow. So it cannot be same throughout the season. I'm sorry, I lost the question.
I'll project it again.
Yes, sir. Can you please do that? Yeah. So yes, if they are the growing athletes, the energy demands will not remain same throughout the season, or because a 6-year, once they are 7-year-old, the energy demands will vary. So you have to have an ongoing and continual consultation. That is why we say that please meet your nutritionist every three months. So you have a proper thorough nutritional assessment along with the revision of your diet plans. So please look into it and consider that the growing athletes will always have different diet demands depending on what when they're competing, when they're not competing, and also it's not just they're playing, they're also going to school and they're doing multiple activities. So when you talk about energy availability or the reservoir of the energy, it has to include and incorporate all the activities that they are doing. So you should consider their activity level and keep visiting the nutritionist and keep revising the diet plan. That's what you can do.
Thank you. I'll go to the question from Dr. Guru from AFMC. Most of the symptoms of overtraining and REDS in an athlete overlap. As a team physicians, we can detect the syndrome at the earliest. And management of both these conditions varies. What is the major differentiating features as you feel in the sports field, Sonika?
So that is why I have shown a couple of risk assessment questionnaire, which are given by the International Olympic Committee, which includes specific questions regarding relative energy deficiency. So you need to, once you speak to the athlete and you have that relationship built up with the athlete, definitely they will be more open to tell you those answers. So you can use these questionnaires, which I just had shown earlier, to differentiate between an overtraining syndrome and the relative energy deficiency syndrome.
Okay, thank you. And question number 7, if you see, is there a role for a sports psychologist in REDS?
Yes, definitely. There is a very, very big role for sports psychologists, because a lot of these athletes have eating disorders, or they will have eating disordered behaviors. So they will not be really comfortable talking to a coach about it. So yes, a psychologist is needed to help them guide through what is the right procedure and what is the right way of approaching this. And also dealing with their issues of insecurities, fears, and dropping from the team. So yes, psychologists have a very big role when it comes to athletes who are dealing with low energy availability.
Okay. And question number 5, if you see from Neha, what are the energy availability measurement systems, devices that you have come across in our country especially?
So Neha, it's a good question. I think I did speak about the DEXA scan that you can use. So if your athlete has an history of fractures or multiple stress fractures, then definitely you should look into it. If they are underweight, definitely you have to look into the DEXA scan scores. you can undergo the blood investigations, which are important to check the iron profiling of the athletes, the cortisol levels and the hormonal levels, to see if the hormones are well in place. So yes, blood profiling is very important. DEXA scans are important. A detailed nutritional assessment is very important. And a thorough, detailed body mass composition assessment is something that can give you a very good picture of where the...
Thank you, Sonika. And there are a couple of questions on the hormonal pills. Have you seen them being used by the women athletes to postpone their periods, whether they use it on the advice of a doctor or they are using by themselves? What has been your experience, Sonika?
So my experience is that no, I have never ever recommended to somebody to use a pill to delay their periods, because I believe that's to disturb the normal physiology. But in case there are certain athletes who really undergo very bad cramps and pains and they cannot literally play, then yes, with the help of the physician, maybe you would want to recommend, you would want to take an opinion if it is needed. But in my life or in my work experience of 10 years, I have never ever recommended anybody any of the pills to delay the periods.
That's nice to know. Probably the last question from Raj, Guru Nanak Dev University. In weight category sports, is there a difference in energy or diet pattern that you have come across or suggest?
So in weight category sports, this is
Like,
one of the
say,
very big
wrestling.
issue. Yes, I agree. What kind of energy or diet pattern would you like to suggest? So I will say when it comes to diet pattern, it is the job of the nutritionist to be done. That is not my domain. So definitely taking a health of the expert is something that I will recommend. You should be discussing this with your nutritionist to definitely, when there is a competition, the diet plan changes. When there is pre-season, the diet plan changes. What you should be taking pre-competition, during the competition, and after the competition. These all are the domains where a nutritionist can help you. And we should not, we as physios, as doctors, I don't think should be very much indulging in this part, as we have experts to deal with this.
Okay, Sonika, that's it from the question and answer panel. You
So,
get other questions answered from you. Thank you.
Thank you all for participating in another wonderful session. So we'll keep you posted for future sessions, and all stay home and stay safe. Thanks again.
Thanks very much.
Thank you.
Thank you very much.
Thank you.
Bye.
Thank you, everyone.
Bye-bye.
Bye.
Bye-bye.
Thank you.